Okay, so we are recording, and so again, welcome. So as a quick run of show, I'm going to introduce our three speakers. They will each speak for about 10 minutes about their respective area of expertise, and then I will field questions from myself and from the audience. So for our audience members, you have a Q&A button at the bottom of your screen that will enable you to pose questions. You can also pose questions in the chat, and so we hope to have the speakers talk for about 30 minutes and then about another 30 minutes of enthusiastic question and answer. So please do feel free to ask your questions. So the first speaker I'd like to introduce today is Liane Lemos. She is the CEO of the Development Bank of the Extreme South in Brazil. She holds a master's in political science and a PhD in comparative studies on the Americas from the University of Brasilia. And she's joining us today from Brazil, where it is already 8 o'clock at night. So thank you so much. She has extensive international experience, though. She received the Fulbright APSA Congressional Fellowship and Oxford Princeton Global Leaders Postdoctoral Fellowship, among others. In fact, her doctoral dissertation was awarded the best dissertation in political science in Latin America by the Latin American Congress of Political Science and received honorable mention from the Cape Species Award. In government, she's held the position of Secretary of Planning, Budget and Management of the Federal District of Brazil and of the state of Rio Grande do Sul. And in Rio Grande do Sul, she was also coordinated the Data Committee on COVID-19 in charge of the strategy of the pandemic management in that state. She has served as Vice President of the National Council of Secretaries of Planning and Administration in different periods in Brazil. And as I mentioned, she's currently CEO and Board President of the Regional Development Bank in Southern Brazil. Welcome, Dr. Lemos. Our next speaker will be Dr. Juliana Martinez Fransoni. She is the Humboldt Chair and full professor at the University of Costa Rica, where she joins us today. You can see her beautiful backdrop. She has received the George Foster Research Award granted by the Alexander von Humboldt Foundation for her research work and attempts to solve development-related issues. She conducts comparative research on social policy, including childcare in Latin America. She also has extensive international experience, a Fulbright Scholar, a visiting fellow at the Kellogg Institute for International Studies in Notre Dame, and the University of Austin. Her most recent articles were published in Social Politics, the Latin American Research Review, and the Review for the Economic Committee of Latin America and the Caribbean. Her most recent book, written with Diego Sanchez Ancochea, is The Quest for Universal Social Policy in the South, Actors, Ideas, and Architectures from Cambridge University Press. She edits the journal Social Politics and has done regular consultancies with different international institutions like UNDP and UN Women. Welcome, Dr. Martinez Fransoni. And our third speaker will be Eduardo Gonzalez Pierre at the Wilson Center Mexico Institute and the Senior Technical Director for Health Financing at Palladium. Eduardo Gonzalo Pierre is an economist, and he brings more than 25 years of experience in the health and social security sectors. He's contributed extensively to the development of health policy in Mexico, including major reforms from varied high-level positions in the Ministry of Health and the Mexican Institute of Social Security. His work focuses on providing sound evidence and analysis to inform policymaking and promoting the development of mechanisms and tools to improve health system performance. As mentioned, he's currently a global fellow at the Wilson Center and the Senior Technical Director of Health Financing at Palladium. So he's joining us from Washington, D.C. We're going down the time zones and getting closer to Los Angeles. And his former appointments include serving as Deputy Minister of Health in Mexico, Executive President of the Mexican Health Foundation, Director General of the Medicosur Clinical Foundation, and Finance Director of the Mexican Institute of Social Security. Welcome, Mr. Gonzalez Pierre. Thank you. So with no further ado, I've asked each of the speakers to talk about COVID-19 in Brazil, in Mexico, and in Central America, respectively. And so we will turn it over to Dr. Lemos to tell us about Brazil.
Thank you very much, Jennifer, and everyone here in the room. I'm very happy to join you today. And thank you, Jennifer, for the kind invitation. I know it's a bit hard to put everyone in the same time zone in this room, but I'm really glad to join Oxy College. Well, I'm going to share here a PowerPoint and, just one moment here, because it's not in the, yeah, now, yeah. Sorry for this. Okay, so I guess everybody's seeing what I see here.
We see your screens, but not your slides yet.
Do you see now the slides?
Not quite yet. We saw them before, so whatever you did right before we got started worked well.
Well, I think I did exactly the same thing, so.
Oh, there they go. We have them now.
Okay, maybe
Perfect.
It's just, okay. So I was invited to talk a little bit about what happened in Rio Grande do Sul, the case of how we managed COVID-19. Do you hear me now? Because it seems it's stopping.
Yes, we can hear you.
Okay. If anything happens, please just let me know.
Absolutely.
So what we did, I was invited to talk a little bit about what we did in Rio Grande do Sul that was different, or how we've handled the pandemic at the state level. As you all know, in Brazil we've had a terrible time, and we did not have a federal coordination. So basically we're a federal country, a federalist country, and 27 governors did what they could do best in their territories, as we did not have a national coordination of the pandemic. So what happened in Rio Grande do Sul? I'm sorry, I'm really having a hard time managing this here. It's not working for me. I'll stop sharing and try it again, because it was not responding. Okay, so I was trying to change and it was not moving here for me. So I hope now it works.
Also, what we could do, Dr. Lemos, if you want to email me the presentation, I could show your slides for you. And while you're doing that, we could pass to Juliana and then come back.
Yeah, perfect. So
okay, let's do that.
Thank you.
You send me your slides via email and I'll get those queued up. And in the meantime, is it all right, Juliana? Are you able to go?
Yes, sure.
Okay, thank you, Juliana. So please, you have the floor.
Well, thank you for inviting me to share some ideas, to be part of this exchange. I'm really happy to be here with you today. And the main question I was asked to refer to has to do with how COVID-19 spurred Latin America, but especially Central America, to expand access to social protection. So I'm kind of asked to talk about the good news. And let me address this matter, drawing on ongoing research I am conducting with my colleague and friend, Diego Sanchez-Sancochea, economist based at the University of Oxford. As you may know, in Latin America, the health emergency created by the pandemic immediately became a social and an economic emergency. With only 8% of the global population, by September 2021, the region accounted for about 30% of the world's COVID-19 deaths, right? To cite a recent article in the New York Times, I quote, "The world's most unequal region, Latin America, saw 22 million people, the equivalent of everyone in New York State, join the ranks of the poor from 2019 to 2020, unable to meet basic needs," end of quote. In all, as we speak today, about 1/3 of Latin America's roughly 600 million residents live in poverty. And this is just to talk about poverty, but we could also talk about children's loss of school days, losses in formal jobs, increases in gender-based violence, gains in income inequality, and so on and so forth. So, in this context, is there any room for optimism? Well, International actors like the UN's General Secretary Antonio Guterres and the Executive Secretary of the Economic Commission for Latin America, Alicia Bárcena, have seen the pandemic as an opportunity for a new social pact, new rules of the game, capable of building back better in Latin America. And largely, this optimism is supported by the initial response to the crisis. Most Latin American countries responded rapidly to the pandemic, reaching millions of people and families, mainly with cash transfers, not only, but mainly with cash transfers, emergency cash transfers. This is not saying that the measures were perfect or were sufficient, not at all. It is saying that by reaching millions of people, states did show that they can do better than what they do under normal times. These measures were generally supported by public opinion and across the political spectrum, which was also news. So let us take a closer look at Central America, which is a sub-region usually downplayed in comparative analysis of Latin America, and which contains as much diversity as Latin America as a whole, as far as social policy. Central American countries are similar in size and geopolitical position, but show remarkable, notable differences in terms of state capacity and social policy. Let me give you 3 examples. With its universal healthcare system, Costa Rica is one of Latin America's best case scenarios. Guatemala is one of Latin America's worst case scenarios, and one in which social policy as a whole spends only 7% of its gross domestic product, or GDP, which is about the same as Costa Rica does in healthcare alone, just to give you a sense. Last but not least, the 3rd example is El Salvador, which was one of Latin America's worst case scenarios in the 1990s, yet following the end of the civil war and democratization, slowly expanded social policy, and by early 2020 was allocating to it about 15% of its GDP, like far from Costa Rica's 24%, but also far from Guatemala's 7%. At the same time, by March 2020, all 3 countries were facing important challenges. And a critical one was the high proportion of informal workers, people without any protection against any shock, let alone a shock that forced them to shelter in place. These were people whose basic needs depend on earnings made that very same day or that very same week. And informal workers amounted to 65% of the labor force in Guatemala, 65%, and to nearly half the workforce of Costa Rica and El Salvador, nearly half of our good case scenario, Costa Rica, right? So what happened in these 3 countries in March 2020 following the pandemic outbreak? The one immediate social response was to implement emergency cash transfers. Guatemala, this worst case scenario we were talking about, succeeded in deploying a massive program that reached over 2.2 million families with 2 or 3 cash transfers of $130 per family, and in the presence of several obstacles, like not having a sound information system and having to face 2 hurricanes that same year. El Salvador reached 16% of the population, about 1.2 million people, with 1 transfer of $300 per family, which was then the minimum formal salary. And Costa Rica reached 13% of the population, about 700,000 people, with 3 transfers of up to $214 per person, prioritizing 1 per family. So more than half of these people were self-employed, informal workers, people who under normal circumstances fall between the cracks of programs either aimed at formal workers or aimed at people under the poverty line. So with variations, and this is one of the 2 points I want to make, with variations, the 3 countries displayed novel state capacities. In Costa Rica, it was reaching informal workers. In Guatemala, it was reaching so many million people within 2 months. In El Salvador, it was to work very rapidly. Cash was in people's pockets 17 days after the declaration of the national emergency. In Guatemala, the implementation of the program was positive enough as to have progressive think tanks and other civil society actors stress that the country's performance had gone against the corrupted and inefficient historical record to act promptly and effectively. This is not saying that there were not problems, of course, plenty of them, several of which we can go back to later. But what was new, and what I want to stress is that the pandemic showed that under pressure, under the right type of pressure, governments with weak social policies are capable of doing better by mobilizing institutional capacities, finding the necessary resources, and expanding, even if temporarily, social protection. So, do these measures create better opportunities for inclusive social policy beyond short-term responses? And this is the second point I want to make, and to respond preliminary to this question. Executive Secretary of the Economic Commission for Latin America, Alicia Bárcena, argues that, I quote, recasting the social contract requires building inclusive social policies, like policies capable of guaranteeing fundamental social rights, such as, think about this, drinking water, basic health, basic education, and basic income for all, end of quote. So social policy is inclusive when it incorporates a growing number of people, including, yet going beyond the poor to reach the low middle class, who is constantly threatened by downward mobility. A case in point being informal workers, many of them women and caregivers. So what we see, Diego and I, is that by themselves, these short-term emergency measures are unlikely to result in more inclusive social policies by themselves. They are unlikely to do so. Yet they can be useful openings in the hands of state and non-state actors interested in pushing for progressive reforms that ensure basic social rights for all at a later point in time. The main reason behind the openings was uncertainty and fear. Political elites feared social unrest. This is something that's coming out clearly in the interviews we are conducting across Central America. So as fears and uncertainty faded, so did the openings. One lesson we can draw is that inclusionary social policy would benefit from enough pressure, such as social pressure within national borders, but also international pressure as posed by powerful governments like the US in the Northern Triangle of Central America, as we speak, or multilateral organizations like the IMF, which has flagged the importance of increased social spending in all these countries. So, in addition to ethics and hope, the current and future fate of inclusionary social policy depends on a shift in power relations, what we usually refer to as political economy. And that is on narratives regarding what needs to be done, but also on actors and policy tools to get it done. If the literature on social policy is correct, the required shift of power, these required shifts of power are more likely to happen in the context of democracy and electoral competition. Something that, regrettably, we cannot take for granted nowadays in Central America, in many Central American countries. So we can probably come back to this matter later in the conversation to address, how this macro political scenario can promote or deter transforming these openings into actually trajectories towards more inclusive social policy. Thank you.
Thank you so much. I think that actually was a perfect way to start. And one of the reasons we are so happy for you to join us today was to tell perhaps the unexpected happy story where many Latin American governments responded to COVID-19 by expanding social protection. And I'm always so struck by, the way you focus on particularly protections for the lower middle class. So we think about the poor, but we don't think about that tier right above that I know you've pointed out in your other work that often is not poor enough to qualify for certain forms of relief, but is still very vulnerable. And so how COVID-19 allowed Latin American governments to attend to these different classes of folks. So we'll talk more about that in the Q&A, but thank you. So we're going to try again now to turn it to Dr. Lemos. So I'm going to go ahead and share my screen and get her PowerPoint started.
Thank you, Jennifer.
Please go ahead and I'll just start.
Okay, so what I was telling is, and it was great to hear Juliana, because now she was talking from a more, let's say, with theoretical instruments. And the story I'm going to tell here is a very hands-on. It's about how we handled the pandemic in Rio Grande do Sul, which is a state, this extreme state in the south of Brazil that is the size of Portugal. It's 12 million people. And so I think the point here, the interesting point here for our reflection is what happens if you're living in a country with 200 million people and you don't have a coordination, right? You don't have a federal coordination. So what can governors do? So what we did, I'm here bringing the story of how we used intensively evidence and analysis and data to help the government to make decisions in the very short term. So could you just start going, Jennifer? And you have to be very fast because it's many slides and I'll be really, you just keep going. So just stop in here, Ali, for the journey. We are talking about a little bit about uncertainty, how we structured the data committee to help the crisis cabinet to make the decisions. We're going through all the products or some of the products that we are providing the crisis cabinet, and what are the challenges that are that we face on a daily basis on the management of such a particular event as a pandemic. So I'd like to start talking about the uncertainty, because then we have this beautiful graph here showing what coronavirus or COVID-19 was in terms of uncertainty for the world. So we are dealing with something that we didn't know. We didn't know how to deal. It's the policymakers didn't know, and scientists didn't know either. So it's something completely new, and we had to make decisions with this very low certainty levels or very high uncertainty levels on the map. So I like to remind everyone of that, and we go to our timeline in which we see when started the management of the crisis and the change of strategy in terms of what was government doing. The first case of COVID in the Rio Grande do Sul was in March. I'm sorry, these are in Portuguese, so it's first slash English. So it's first day and then month. So it was on March we had the first case, and what are you going to do about it? So we started doing, I was at the time Secretary of Planning, and started working with scenarios of how would the pandemic happen in Rio Grande do Sul if you were Germany or Italy or China, looking at their data and simulating the pandemic on the territory. So in the same month, we had the crisis cabinet established, everything by decree, so it was very institutionalized. I'm not going to go through everything, but the fact is the governor created this crisis cabinet with secretaries and different members of social society and not members of other powers. So the legislative branch, the judiciary, they were all in working together with the executive branch, but also he created a data committee and a scientific committee to work with the government. And I was at the time secretary, and at the same time coordinated this committee. And we have different phases in this governance. And we can go ahead, Jennifer, please. So this was kind of how it looked like, how the governance worked. We had meetings every day and then 3 times a week. And as the pandemic was softening, we are having fewer meetings and then more meetings according to the level of the pandemic, the impact of the pandemic. So what did we do in the data committee that I think it's worth sharing with you? The strategy was, well, we need experts, and they are not only in the government, so we have to put a lot of people together. It's a mix of experts, statistics, data analysis, production of contents and studies, so that the government would make their decisions on where, when, and the intensity of closing or opening businesses, closing and opening schools, and etc. What was going to be the decision of the government? And so we joined experts from different institutions to subsidize the cabinet with pandemic data, projections on the evolution, now the epidemiology of COVID-19, and projections also on economic and social status and areas that are being impacted by the pandemic too. So we can please go, Jennifer. Yes. So who did we involve? We involved 123 experts. They were from different 40 institutions, 13 universities or colleges, and 25 public agencies throughout the state. This is how it looked. We shared our, actually we divide our work in issue areas. So we had the health area, the economic area, the social and social assistance area, infrastructure, logistic, mobility. We have different areas dealing with different kind of information and everything put together. And some people working on communication, which I think it's the great challenge. So yes. So these are some of the products that we did, and they are still being produced. We first did a risk matrix, then prevalence study with the Federal University of Pelotas, models, epidemiologic models, daily bulletins on hospital, occupation, and pandemic evolution, looking for 11 different variables. We are doing studies on job market, economic activity, GDP, the state GDP. We are monitoring infrastructure or the water and energy provision. We are looking for mobility. So we had studies every 2 weeks in isolation of the population and, you know, all those Google Maps. I have brought some information here, how it looked like, but we are doing that on daily basis. Models also, we are proposing for the cabinet some policies. I think Juliana mentioned that, how to distribute the resources you have economically so that the vulnerable population is assisted. So we had all those models of resources distribution. We did a lot of benchmarking on policy, be it income, employment, food security, mental health, education. We're looking at different places in the globe and what are other countries doing, what are other states doing, and we're trying to simulate that in Rio Grande do Sul. And also we have created this methodology and the protocols to manage the pandemic, or the control distancing as we did, which is this flag system I'm going to show. So yeah, we can move on. So this is just visual, you don't have to read everything, but we are looking at the risks and say, well, what can happen in security for us? Well, we can have more domestic violence, we can have more poverty, we can have more people who live in the street with higher contagion indices, sorry. So a higher contagion in people who are living in the street. And we can have problems with energy distribution, for instance, So all kinds of problems, 45 risks were mapped and they were ranked. Yes, please, Jennifer. So these are some of the bulletins that we have. So we have daily bulletins in the case of what's happening in the world and other states we are comparing, and in different municipalities this was programming. So we had some people from statistics, some epidemiologists, some economists, some programmers who were working on all this information. Also on the hospitals, we have information on private and public hospitals, how many beds are free, how many are occupied with COVID, and etc. These are some projections. We also were using SEER, epidemiological models to anticipate occupation of beds and deaths. We are also doing random tests on population. We did that to monitor, we did 9 waves to monitor how the pandemic was spreading in the territory. Please, Jennifer, you have to, yeah, this is comparing national, international data, restrictive measures in different countries. You can go, please. It's just, yes, these are some of the health products and some of the economic products too. You're looking for the job market, provisions, trying to anticipate the unemployment rate. We are looking for how many people were demanding the support for the welfare in the case of unemployment, right? People who are getting unemployment and looking for benefits. So you monitor all kinds of information that we have, and you're bringing this every week to the crisis cabinet, and also putting this in the internet in our website so that everybody could have access to this kind of information. We're making studies on, for instance, how many homes did not have a bathroom in the state, so that we could provide some policies for that. Also, how to share or how to distribute money, not only the cash transfer, but also for the kids who are not going to the school and are very vulnerable. How can we are going to make more money to get into those homes with small children? So you're doing these models also. You can go ahead, yes. So different, we're doing benchmarking and also policy proposals. And these we're looking for energy. We're looking also, we had a very rough dries in the state in 2020. So we are crossing data on water access and the pandemia during the dry season, and this in terms of logistics. So the result was that what we did for the state, for Rio Grande do Sul, was a model for 7 different states: São Paulo, Minas Gerais. We also had more than 100 we call products, but studies and analysis. So more than 500 daily bulletins comparing countries and states, more than 350 daily bulletins of hospital occupation, projections, more than 35 projections of pandemic evolution for hospitals and deaths. And also we have this web page in which we have all information that's downloadable. So people could also have access to, well, I live in one city and how many hospitals I have, how many beds are occupied, how many are not occupied. People could see that on the map, right? So it was very easy to get access to the information. And we also produced, one of the main products of the data committee was the flag system. So what we did was to put 11 different variables in the model, and we are following how many deaths, how many beds occupied, how many exams were going positive, state capacity versus the spreading of the pandemic. And so from May last year to basically September this year, we are producing every week, following the data and producing the flags every Friday, and it was showing in different regions, 21 regions within the state, we are identifying how the pandemic is going in that place, how pandemic was going in terms of the spread, but also the occupation of beds in hospitals, right? And you were doing protocols for different regions. So if your region is yellow, you have one kind of protocol. If it's red, you have different protocols that are stricter, they are heavier. And the colors you used were yellow, orange, red, and black. I have 2 minutes, so let's go. You can just hover. So we did some protocols that some were mandatory, some were non-mandatory. I think we can go to the end, Jennifer, just everything we're using information.
You just tell me when to stop here.
Okay, no, you just go ahead. It's just very visual so that people can see the kind of information that you're generating. But I think that the good news is that the state has, in comparing to other Brazilian states, the lowest death rate in Brazil, meaning not only the registered death rate, but also in comparison to the previous years, the excess death rate, showing that probably this management with a lot of information and making decision based on these evidences was good for, saving lives. Also, it gave time for the government to increase the number of beds that were available for the population. So what I think is the final challenge here is one, communication, second, transparency, and third, you get a lot of people involved in terms of network to build something like that. And thank you very much. I'm here then for the Q&A.